The Women's Health Initiative study was a study whose goal was to look at the long-term effects of synthetic hormones, namely Premarin and Prempro. So this study looked at postmenopausal women who were given these forms of oral synthetic hormones. And the study actually had to be stopped early in 2002 because women were experiencing increased rates of breast cancer, blood clots, heart attack, and stroke. So after this study came out, that is when providers and the public began saying that all hormones are harmful, and there was this misconception that all hormones are bad for the body and they can cause these detrimental health outcomes, and women should stop their hormones immediately or be on the lowest dose for the shortest duration of time. The fact about the study was, though, that this only looked at oral synthetic hormones, Premarin and Prempro. It did not look at hormones that are applied transdermally or topically through the skin in different forms that tend to be more physiologic to the way the body produces hormones. So what we can take from this study is that yes, hormones in a specific form, which are synthetic, taken in a specific way, which is orally, can cause these increased risks. But you cannot extrapolate the information from that study and say, well, every hormone given, no matter what route of application, is going to have these same risks. You really can't do that. And hormones applied transdermally through the skin, especially estrogen and progesterone that is more physiologic, they have not been shown to carry these same risks. In women, hormones are administered through different routes of administration, just depending on which particular hormone we're talking about. With estrogen and testosterone, they are typically given transdermally through the skin. The reason for this is we want to avoid taking the hormone orally, passing through the GI tract, and avoiding the first pass effect in the liver, which can decrease the bioavailability of the hormone in the system and also cause strain on the liver over time. There's also a concern that taking estradiol orally, especially in women with underlying risk factors for cardiovascular disease, it can actually increase their risks of dislodging a clot from their arteries and causing heart attack or stroke. So oral estradiol is typically not considered to be recommended in an elderly woman, especially if she has underlying risk factors for cardiovascular disease. So taking estradiol and testosterone transdermally, which is through the skin, does not carry those same risks. Now, when we're talking about other hormones like progesterone and thyroid, those can be taken orally and don't carry those same risks. After starting hormone replacement therapy, women typically notice a significant improvement in any symptoms associated with the underlying hormonal imbalance. So depending on the hormone that we give, let's say for example estrogen, women notice improvement in the symptoms of low estrogen, including hot flashes, night sweats, moodiness, irritability, even vaginal dryness and painful intercourse can improve. When we're giving progesterone, women can notice that they have improved quality of sleep. Also, it can stabilize their mood. Progesterone is also important to give in conjunction with estrogen because it balances and opposes estrogen and prevents overstimulation of breast tissue and uterine lining. And testosterone can also be given to women to improve sexual functioning, desire, and drive. It can also improve women's energy level, sense of well-being, mood, confidence, and development of lean muscle mass. And there's even new research showing that it improves memory and cognitive functioning. And with thyroid, we see improvement also in energy. Women are able to maintain an ideal weight. They'll notice they're not as sensitive to the cold. Hair loss and thinning will improve. So each hormone can be given based on specific deficiencies present in the woman and also looking at her symptoms. And we'll notice improvement typically in all of those underlying symptoms of hormonal imbalance and improved quality of life.